You know, stroke is a rather diverse set of diseases, and so to really understand it, we have to talk about ischemic strokes, which I think is usually what we mean in this space, but also intracerebral hemorrhages and the relationship between vascular disease and other neurological problems like cognitive disorders. And I think in each of those spaces, we're seeing progress. As you know, in ischemic stroke, there has just been this stampede of progress over the last decade. With the emergence of thrombectomies and other interventional techniques to try to improve acute stroke care. And we're seeing that continue to develop, that our ability to intervene and help patients is just continuing to advance at a remarkable rate. And not just in the operating room, but also related to patient selection and triage with progressively more artificial intelligence incorporation into that process. And so it's really exciting to see the acute phase of acute ischemic stroke treatment really advance. But I think we're starting to see some real signs of life related to intracerebral hemorrhage as well. You know, the operative management for intracerebral hemorrhage has been controversial for a long, long time, and I think it'll probably stay somewhat controversial. There's a lot left to do, but we're starting to see some serious signs of life from the clinical trials related to acute intracerebral hemorrhage treatment, and hopefully that's the beginning of a process. I'd like to see more development there, but I think that's really exciting. And then obviously blood vessel diseases contribute to other things, and my research, the area that I spend most of my time thinking about, is the relationship between blood vessel disorders and cognitive disorders like Alzheimer's disease. We don't think about Alzheimer's disease as being a blood vessel disease, but it absolutely is. And when we look at the literature and the clinical trial results around Alzheimer's disease, a lot of the complexity is coming from the blood vessel involvement. A lot of the side effects we see with some of these new immunotherapies are related to a vasculitis and an encephalitis. And so understanding the way blood vessels are involved in these other disorders can be very, very important. And in real life I think we think of these as standalone disorders because it's helpful to categorize them that way. But really, in real life, they almost always exist somewhere on the spectrum of vascular disease. And in some cases, it can be a very substantial component of the disease.